So, let's study with the peculiarities of the cervical vertebra. Here is two cervical vertebrae and there is thoracic vertebra. As you see, there is some difference between the cervical vertebra and thoracic vertebra. The body of the cervical vertebra is much smaller than there is in the thoracic vertebra, and vertebral foramen triangular in shape instead of round in the thoracic vertebra. And then posteriorly we have spinous process, but if you see in the end of the spinal process, it is divided into two parts. It's called bifurcation. So we have bifurcated spinous process. On the transverse process, you can see the other peculiarities. Transverse processes have the transverse foramen, foramina transversarii, foramina transversarii. The first cervical vertebra, it's called atlas. And if you compare with other cervical vertebra, atlas has no body. Yes, there is body and there is no body. But we have two lateral masses, massa lateralis, massa lateralis. Anteriorly we have anterior arch and posterior arch. Arcus anterior, arcus posterior. On the anterior arch, you have to identify anterior tubercle, tuberculum anterior, and from inside, from the vertebral foramen, we can see articular surface, fovea dentis. Here is, let's see, fovea dentis, for the articulation with the second cervical vertebra. On the posterior arch, we have posterior tubercle, tuberculum posterior, instead of spinous process. On the lateral side, we have transverse process with the transverse foramen. On the superior surface of lateral mass, we have articular surface, facies articularis, for the connection with the occipital bone. And on inferior surface, we have another articular surface for the connection with the second cervical vertebra, which is called axis. Now let's talk about the axis. Yes, if you see this vertebra, yes, it has some peculiarities between the other cervical vertebra. The main peculiarity is a prominent process on the anterior surface, anterior superior surface of body, which is called dens axis. On the top of the dens, you can identify the apex dentis. On anterior surface, there is articular surface for that connection with the atlas. For the connection with the atlas. On the lateral side, yes, we have superior articular process and inferior articular process. There is transverse process with the foramen transversarium. Next vertebra, yes, it is thoracic vertebra. Thoracic vertebra consists of body and vertebral arches. Here you can identify the spinous process, which goes downward and backward. Here we have transverse process, superior articular process, and here is inferior articular process. The main peculiarities of the thoracic vertebra, it is that on the lateral side of the body we have articular surface for the connection with the head of rib. It is called facet or demi-facet. If we have complete fovea, it's called facet. If we have incomplete, it's called demi-facet for the articulation with the ribs, head of ribs. Another peculiarity is that another articular surface is placed on the transverse process. And this surface is called facies articularis tuberculi costae. Articular surface for the connection with the costal tubercle, which is placed on the transverse processes. Next vertebra is called lumbar vertebra, yes, and if we compare with the thoracic vertebra, yes, you can see some peculiarities. Lumbar vertebra has a large body. The spinous process quadriangular in shape, and we have good marked transverse process, superior articular process, inferior articular process, and close to the transverse process we have accessory tubercle, tuberculum accessorius, and also mammillary process, processus mammillaris. Another bone that you have to describe, it's called sacrum, os sacrum, sacral bone. Sacral bone has three surfaces: anterior surface, facies anterior. Then on the back we have posterior surface, facies posterior. And if you see it from the lateral side, we have lateral surface, facies lateralis. Also, sacral bone has the base, basis ossis sacri, and the apex, apex ossis sacri. On the anterior surface, also it's called pelvic surface, you can see transverse lines, linea transversa. Lateral to this transverse line, we have openings, sacral foramen, foramina sacralia, foramina sacralia. On the dorsal surface, in the midline, we have median sacral crest, median sacral crest, crista sacralis mediana. Lateral to this crest, we have intermedian sacral crest, crista sacralis intermedia. And lateral to this, we have lateral sacral crest, crista sacralis lateralis. Also, on the posterior surface, we have posterior sacral foramen, foramina sacralia posterioris. On the lateral surface, you have to identify this position, it's much better. You have to identify lower portion, which is called auricular surface, facies auricularis, and sacral tuberosity, tuberositas sacralis, tuberositas sacralis. If we look on the base of sacrum, we can see a prominent part which is called ala, ala sacralis. Then we have superior articular process, processus articularis superior, and prominent part which is called promontory, promontory. On the apex, on the posterior surface, yes, you can see the end of the sacral canal. Here is sacral canal, canalis sacralis, and there is hiatus, sacral hiatus, hiatus sacralis, which end by the two horns, cornua sacralis. The lower part of vertebral column, here we have coccyx. Coccyx formed by the fusion of 4 coccygeal vertebrae. The coccyx has the base and the apex. On the base, you can identify another 2 horns, cornua, ossis, coccygeae. And on the lateral side, there is transverse processus transversus.